It is my pleasure to introduce the next set of speakers we have today, the first being Dr. Moore, a cardiothoracic surgeon with the Health Texas Provider Network here in Plano, and he is also the patient safety officer at the Heart Hospital Baylor Plano. Dr. Moore has practiced in the Dallas Metroplex area for over 20 years. His extensive heart surgery experience includes coronary artery bypass procedures, as well as heart valve repair and replacement. He is proficient in carotid, aortic, and peripheral vascular operations. Additionally, he is well-versed in the management and surgical interventions of lung cancer and tumors of the mediastinum. Speaking after him is a former guest of the Heart Hospital, Mr. Kevin Kirksey. He is a patient of Dr. Moore's, and he is the VP of a worldwide sales technology company and travels extensively to speak about communications technology. As an unexpected medical diagnosis brought him to the Heart Hospital, where he encountered a life-changing series of events, he is here today to discuss the personal interactions he experienced while hospitalized for cardiovascular care.
Thank you, Holly. It's my pleasure to be with you all this afternoon in honor of Nurses Week. Kevin is a patient of mine, as Holly mentioned. He was diagnosed with coronary artery disease a little over a year ago, and it's been my pleasure to have known him and had a chance to operate on him and see him restored to his full functional and vigorous life. Kevin is the kind of patient that we all like to have as heart surgeons. Number one, he lived, and number two, he lives and likes to tell about it, and number three, he is a very energetic and gifted individual who has taken a lot of the enthusiasm, I think, that he was able to apply to his business and has applied it now to his health. And he's really doing great. And in addition to that, we get to see him on the billboards, and I can say, that's my patient up there. So this is Kevin and his wife, June. They're with us today, and their son, Kevin. Kevin was pretty hard driving. I don't know if he would consider himself a workaholic, but just from the things he told me, he traveled a lot. He had business that a lot of times was in California, and he really didn't think he had any significant medical issues. He did have some medical problems, but he felt really pretty good, and he wasn't that concerned about his health. So a little over a year ago, he went in to his physician and just for a routine physical and examination and health assessment. And really nothing new, so he's about to leave, and Kevin says, you know what, is there anything else we need to do? And the doctor considered Kevin's risk factors. And the pointer's here, okay. So he was a young man, had no symptoms of coronary disease, and he had a number of concerning factors here which really had not manifested themselves in any way in coronary disease thus far in his life. But a strong genetic history with his father having had an MI at the age of 52. And he also was hypertensive, although controlled, and he had a diagnosis of type 2 diabetes. I don't recall if he had had that for very long, but I don't think that it was a long illness. It's something that came on a little later in life. And he also had a significant smoking history. So, in light of those risk factors, his physician decided that it would be a good idea to do some other additional screening on him, which they requested in the form of a calcium score. A calcium score is a high speed CT scan which really is able to quantitate the amount of calcium that's in the coronary arteries. And you can have a score of 0, and you can have a score like Kevin's here. Sorry. Which 6,518. That's the highest one I've ever seen. And if you look at his percentile, he was in the 90th percentile for men his age for the calcium score, meaning that only 10% of people his age would have a higher score. So that was clearly abnormal, and in light of his risk factors for coronary disease, the decision was made to move on and do a nuclear stress test. Nuclear stress test also was abnormal, with showing evidence of inadequate blood supply or ischemia on the inferior or lower surface of the heart in the distribution of the right coronary artery. So in light of those things, he moved on to cardiac catheterization, where he was found to have 3-vessel coronary disease with good preserved ventricular function. So I wanted to, and then bypass surgery was recommended. So I was able to get a few of the images from his cardiac cath to share with you. And what you see here is his right coronary injection. It's completely occluded. All you see are just some collaterals that are swirling around here. The right coronary, in his case, occluded probably over time, and he never suffered a heart attack or really even any symptoms of angina. This was pretty, although it sounds remarkable, we see this, not that infrequently in our practice. So this is the right coronary injection, and here is the left one. And this one you can see, here is the left main coronary, and this is the LAD, which comes out to the front of the heart. And there's a very tight narrowing right there. Uh-oh. Yeah, all right. So in addition to that one, you've got this one down here, which is in the circumflex system. These things were thought to be at least 90% in this one and this one. And then his right coronary, you can see filling by collateral circulation. The 2 big branches of the right coronary are here. And this explains why he didn't suffer a heart attack or an MI, because he had enough collateral circulation to keep the lower part of his heart or the inferior surface alive, and actually without even any major, if any, symptoms. So our plan for him was to do bypass surgery with plans to graft the anterior descending, which we used his left internal mammary for that. And we used his right internal mammary for this one, which was the obtuse marginal branch of the circumflex. And then we did a vein graft to this posterior descending branch of the right coronary. So this is his ventriculogram, or shows the dye inside the left ventricle, and his heart squeezes very, very well and normally. So here Kevin and his family on the day of surgery. It's his son Kevin and his wife, and then June and Kevin. He's obviously optimistic. I included some of these pictures I'm about to show you. Really, this isn't actually Kevin's operation. This is some pictures taken from a previous surgery many years ago that I had done, and the idea here is to show you that as a heart surgeon, we don't operate alone. We have a lot of help and support. People, in this case, here's my surgical assistant here getting some vein from the leg while I've got the chest open and I'm taking the internal mammary artery down. We've got 2 scrub techs here on this, and this is just what you see right here. Behind us here is the heart-lung machine. There's a perfusionist back there who's a highly skilled individual who will run the heart-lung machine and basically do the work of the heart and the lungs while we have the heart stopped and can work on it. And then up above here is where the anesthesiologist lives. He likes to think that this is the blood-brain barrier here, but I tell him he's wrong. But he is very critical to the success of the operation. Number one, you're taking a sick patient in there as far as the heart is concerned. You've got to get him safely asleep, get all these lines into him so we can monitor his heart during and after the operation. Transesophageal echo probe has to go down, and he's got to be able to look at all that and keep an eye on the patient while we work. And he's then got to be there to help the patient when he first comes off the heart-lung machine, monitoring him and getting the bleeding stopped, and then getting him, out and stable. So Dr. Watkins was our anesthesiologist, has been with me for actually coming up on 26 years. You understand why I put up with him. But he does a great job, and he really cares for his patients, and he was there that day for Kevin's surgery. This is a good picture. It shows the hands of the surgeon and the assistant. Here are my hands here. Here's the assistant. And then here's somebody's hand coming under here who's actually holding the heart so we can get the heart elevated up to see the backside of it where we needed to put one of the bypass grafts. But I like this because in a way it reminds me as a surgeon that it takes many hands to do these things. It's not just mine. And I often get the credit for it all, and I have no shortage of encouragement and praise every day for what I do. But I think it's important, especially during Nurses Week, to remember that the success of what we do is very dependent on others, the others around you that give you support and then do all the things that you can't do when you're in the middle of doing an operation. This is Terry Theologius. He was the physician's assistant who helped me on Kevin's operation, and he's been a great assistant over the years that he's been there. And here's Dr. Watkins. He's a little bit younger in that picture, and I think he's smiling behind the mask. And then we also have the perfusionist here, and this is the heart-lung machine here, where they're managing that during the course of the operation. And we don't have any pictures, but they're circulating nurses that are in the operating room with us, that they're answering the phone for us, they're bringing in things that we need, they're adjusting the equipment that we're using, and also maintaining the music. So that's it. And then, of course, nursing. This is Terry Guardo. Terry is one of the nurse practitioners at the Heart Hospital and was involved in caring for Kevin. She's been excellent in terms of helping us when we're not free to see patients during the course of the day. She's there. And then I'd also like to say that when you think about nursing, you have to remember that the surgeon does the operation and then usually moves on to the next one, right? And I will make a visit to see the patient every day while they're in the hospital, make sure they're doing okay, give some advice about what we need to do for the patient that day. But as far as actually getting those things implemented and getting the patient through and out of the hospital, the nurses are with the patients 24/7, right? I mean, they're there encouraging them, trying to make sure that all the things that the physicians that are involved with the patient want to have accomplished, get accomplished, and really being their advocate and reporting things to the doctors when they're not there. And so I just want to say that it's been a privilege to be here today and to thank you all personally for all the good work that you do. And of course, the real blessing that you have in being a surgeon is to see a patient that had a serious problem restored to life and back in the full swing of life. And I think that's what we see here. Thank you.
The lunch was so good I was going to take some home with me if it's okay. So I'll keep this here. Well, thank you. That was quite I've never really had an opportunity to hear him talk where I was part of the subject, so that was quite interesting. So thank you very much. A little bit intimidating, but it was nonetheless quite interesting. So the topic is an interesting one. So I'm Kevin Kirksey, AKA K2.0. Probably doesn't mean anything to you right now, but I assure you by the time this is done, you'll have a sense for what that acronym actually stands for. It's my lovely wife, June, of 33 years and 2 weeks, and the 23rd of this month will be 34 years. And my handsome, intelligent son, Kevin, and I don't remember how old you are, but it's it's been a while. You know how it goes when you become a parent. Anyway, thank you both for being here. I really do appreciate it. I understand that this might be the first time a former patient or guest has been on your agenda, and so I'm very proud and honored to be here and to have a chance to visit with you for a little bit. I do want you to know that you know, if you hear something funny, it was probably meant to be funny. If you hear something that, as Brian would say, it makes you want to throw rotten tomatoes, please don't. I just had this dry cleaned last week. And if you hear something about my story, which actually ultimately really truly becomes your story, or my experiences, or my outcome, then that's okay. So I'd like to get started. Angels that walk among us. I literally came up with this title one day when I was thinking about what could I come to a room full of highly skilled, highly talented, highly experienced professionals and clinical folks, what could I talk to them about? What could I offer them that they might not have the type of perspective that maybe I had? So I want to share with you something that I have concluded. One is, as patients, our surgeons, in this case Dr. Moore, literally hold our hearts in their hands and they restart them. You all hold our lives in your hearts and you restart them. Not only do you restart our lives, you form and shape and contour them in perhaps ways that you have not contemplated as of yet in your career. Perhaps as angels would, perhaps as angels could. And you do this through very simple, straightforward, caring practices. So in my set of experiences, angels come in many forms, indirect forms, not necessarily directly right at you in your face, but indirect forms. Quiet, nurturing, protecting, guiding, and in all cases, unselfish. So before I get started, I want to let you know that speaking actually makes me nervous. I actually, in my career, I do a lot of speaking, but I get really, really nervous when I think about speaking in front of healthcare professionals because I'm not in this industry. It's not common to me. It's very, it's different. So I was on an airplane flying to Los Angeles the other day, literally. And I sent my wife an email. You know, they have Wi-Fi on airplanes these days. I don't know if you know that or not, but they do. It's really kind of cool. So I sent her an email, and I was saying, hey, this thing's coming up. I'm really nervous about it. I said, have you looked at the agenda? There's so many talented people at this thing. My wife writes back. She sends me an email back, and she says, you know, they are experts in their field, but you are an expert patient, so it's okay. So that made me feel good, so thank you for sharing that with me. The other thing is, whenever I get nervous, I like to find myself in a setting that I'm familiar with, that I'm most common with. And when I think about where I was at the Heart Hospital, and I think about being around you, the thing that makes me most familiar with is when Dr. Moore was done with me and they woke me up and I was alive, the first thing I saw was a guy named Brandon Driver. So Brandon, are you here? Come up here, come here, come here. Come on up, hurry up. That timer says I only have 30 minutes, so hurry up. And I like to talk, so yeah, I mean, while he's walking up here, I mean, when they bring you out of whatever this thing is that you're in, I woke up and there's this guy, and it's him, and I'm like, what is he doing here? And I'm looking around for my wife, and I see my wife, and I look at her like, who is this? Come on up here. It's okay. So for me, you seen one of these before? No. Okay. So Come over here. All right, so wait a minute. I don't really know how this goes, but it went so. Face me.
You gotta undo this here.
No, let's don't do that.
Okay.
Just face me. Take this,
Yeah.
right? Take this like you're going to do something. Now, something tells me that you need to have. No, I think when you do it, this foot's further out. This right foot. No, the other way around. Go that way. Okay, right foot out. Now, you got to look down here like you know what we're doing here,
Oh, okay.
right? Okay, so I've actually start to feel very familiar. I feel like it's deja vu, Brandon. There you go.
Oh, nice.
Thank you. Appreciate it. You can keep this.
Oh, thanks.
All right.
Thanks.
So what he didn't know was I was thinking, hurry up, Brandon. I've got to do my 2 laps so I can get the heck out of here. I've got a hot date with my wife. That's what I was really thinking. So I want to tell you about my story, and I really don't think of it as my story. I think of it as your story, and I'm just a vessel that communicates it. That's all I really am. I want to tell you about the fateful question, the realization that I'm really in trouble, this notion of one shot to live. And I want to tell you about an intimate dialogue with the starter. You might not know what that means, and I'll tell you right now, the starter is this guy, Dr. Moore. I'm going to tell you about what goes on between what could go on between a patient and a physician that's going to perform this kind of surgery very soon before the surgery. I want to share something with you that you don't know. And he doesn't know what I'm going to share with you either, so he's probably nervous. And then also, there's that evening before, what goes on between a husband and a wife? What is said? What's actually going on? I can't tell you about other people, but I will certainly share with you what happened in my situation. And I want to talk to you about when these angels begin to appear. And they begin to appear in what I've referred to as the little things. Remember I told you about how you all restart lives? And you have our lives in your hearts, and you shape and mold them. I want to talk to you about going from the dark to not the light, but from the dark to the life. And then possibly in ways that angels do or angels could. And I've coined it. I've coined this thing. Some of you know me as the guy that talks about Life 2.0. That's what I talk about, and that's what I want to share with you. And I want to conclude with how they carried me and how they cared for me and say, who are they? So about us, 36 years ago, and this is where the women in this audience are going to absolutely hate me. 36 years ago, I was walking out of a discotheque with a lady I had met that evening. And as I was walking out, I see her, and she stops me dead in my tracks. And I forget who I was with. I go up to her. Now, I also feel in the other part. What actually was going on that night, she was at the discotheque in the I really don't like men mode. And I'm here at this discotheque to see how many men I can turn down and tell no to dance. And I didn't know this. So I go walking up and I said, hi, my name is Kevin. Would you like to dance? She didn't say yes. She didn't say no. She looked at me and she said, maybe. I go, what do I do with maybe? That's kind of crazy. There's all these men standing around her, and they're afraid to ask her to dance. And so now I'm thinking, I'm going to be one of them. I'm just standing here. What do I do? So I said, would you like to talk? And so she decided to talk to me. The picture of me at the door is our very first date 36 years ago. I took her out to a really high-end restaurant. What I thought was high-end probably cost me $20 that night in Houston, Texas. Now, I thought I looked pretty good in that baby blue leisure suit. And although you don't see it, I believe I had on white patent leather shoes. And my blessed wife, it took her 20 years to whisper in my ear one night, you know, I've been holding something from you for all this time. You really looked hideous that night. So she has loved me unconditionally since day one. She's always made me to feel like Superman. I guess that's why I chose to dress like Superman at some Halloween party we went. And I really felt like I could solve every problem and fly over every tall building, and nothing would get in my way until the day I had to meet you all, because there was a problem that this Superman couldn't fix. You also don't know that she is a registered nurse by training. This was when I don't know who took this photo, if I was up there seeing her during the shift when I wasn't supposed to or what, but this was in Houston, Texas at a private hospital where she was a floor nurse on a med-surg floor. And just shortly before that photo, maybe a year or 2 years before when she was in her nurse's training, she actually had an opportunity to observe that the observatory surgery by a very famous heart surgeon by the name of Dr. Denton Cooley at St. Luke's Hospital in Houston. And I think about that, and I think, that young lady at that time probably had no clue that her future husband was going to be on that same table, being operated by a surgeon more talented than Dr. Denton Cooley, by the way. So we got married. If you've ever read the book, The Notebook, or if you've ever seen the movie, I can tell you without going into detail that our story and our situations makes that look all very, very tame. We are deeply committed and deeply in love, and it's been an amazing story for us. And then we had an amazing child, Kevin. That's what this guy that I don't know how old he is, I don't know how old he was in that picture either, but he was our family. So as Dr. Moore said, I felt great. Just before I met you all, I was out chopping trees in my backyard, and I was going out to dinner, and I was going to the Rangers game with my son, and I was living life and working hard and feeling fantastic. I could go out and run wind sprints, and I didn't know how to problem, except risk factors. So they tell me, I kept track of them. I had high blood pressure, I took medication for that. High cholesterol, I took medication for that. Type 2 diabetic. Actually, just before I met Dr. Moore, maybe a couple of months, my doctor actually told me I need to start insulin. And for the first time in my life, it was the first time I didn't do what a doctor told me to do, but I was at that point. Overweight, I'll tell you about that in a minute. Stressful job, active but no exercise, history of tobacco use, and there's history of cardiac disease in my family. So as Dr. Moore described, I was leaving my doctor's office. I literally was walking out the door. I stopped and I turned around and I said, is there something else I should check on the inside of my body? He looked at me and said, yes, go have this calcium scan. I asked him what it was. He told me, just go down to the whatever floor it was over in the building and have it. And so I never acted on my health, but that day I walked in there and I said, do you do these scans here? And they said, yeah, would you like to have one done right now? And I said, no, I'm too busy. And they said, would you like to come back on Monday? And I said, oh, okay, I'll come back on Monday. I went back on Monday, had the scan, jumped on an airplane, went to San Jose, California the next day, and then that's when it all started. My phone was ringing off the hook. I finally stepped out of a meeting. It was my primary care physician's nurse. She said, I'm sorry, the results are not good. And I said, well, what does that mean? She said, it means that they're the worst that he's ever seen. And I go, well, what does that mean? And she finally said, I'm so sorry. It means that you are at an extreme risk of a cardiac event at any point in time. And I'm on my phone 2,000 miles away, and I said, what do I do? She goes, where are you? And I said, I'm in California. She said, can you come home now? And I said, yes. So I came home. She said, we've made arrangements for you to see a cardiologist. You've got to see him tomorrow. I said, okay. So I'm nervous. I'm emailing back and forth with my wife on the airplane. Hey, I've got this high thing. Well, how high? I don't know. She's researching it. She finds out about this scan and the test, and Dr. Moore talked about it. You can have 0, or you can have something like I had. And if you go to Dr. Google will tell you that this is kind of the range of scores that you would see, and 400 and above could necessarily mean it's a potential marker for probability of having cardiac disease. And I didn't know what my score was, and my wife asked me when I got home. I said, I didn't ask her. So I called her up and I said, what was my score? And this is when the 6,518 came up. And I told my wife, something's wrong. The machine's wrong. It's got to be wrong. This is so far off the charts. So I said, certainly, my primary care physician is not a cardiologist. So when I see the cardiologist, they'll certainly know exactly what's going on. Saw the cardiologist. I said, I'm here because of this. I feel great. This doesn't look good, but I'm sure you've seen one like this. And he kind of says, no, we have not seen this before. And now I'm starting to get really scared. Now I'm getting very nervous. So I knew I was in trouble. So they do the normal things that they do. They run the nuclear stress test and the CT scan and all those things that they do. I don't know the test, but so I want to describe a level of anxiety and fear that was going through me. Somebody who felt like on the outside and inside was absolutely in great physical shape, even though I wasn't. But the machines were telling the physicians that something terribly was potentially wrong. So in my mind, I hear extreme risk at any moment, highest we've ever seen. I'm over there at where all the cardiologists do their test, and I was able to see a cardiologist that day. I'm pretty good with getting what I want with people, and I knew how to get some attention to tell me what's going on. Let's get out of protocol and tell me what's going on. And I won't name his name, but a cardiologist was kind enough to tell me what's going on. And he looked at me in the eyes, he said, "Are you sure you feel okay?" And when he looked at me in the eyes and said, "Are you sure you feel okay?" that spooked me. And I said, "Do I need to go across the street and check myself into this hospital right now?" And the answer was, he hesitated. And he said, "No, go home and relax." Right? Really? Go home and relax. Okay, I'll go home and relax. Come up the next day and have a catheterization procedure, which I did. So in my mind, here's what's going on. She's not ready. I must fix this. How can I fix this? I don't know how to fix this. My mind is reeling. My unborn grandchild won't have a grandpa. Have I played catch with my son for the last time? How do I make peace with my Maker? They say that's what you're supposed to do. I don't know how to do that. I've never read a manual on it. I've gone to church before, but nobody's ever told me how do I do this? I need to do it now. Something's going on that's not supposed to be going on. So I go have my catheterization done. Cardiologist, Dr. Wilbert, some of you know Dr. Sam Wilbert, was the one that did it. He's in the procedure. I'm awake. I'm a talkative guy. I said, "Hey, Doc, how's it going?" And we just got started. And he comes up to, he puts his face right up next to mine. I'll see this until my grave. And he goes, "Young man, you've saved your own life." And I go, "Why?" He goes, "I can't do anything for you. We'll get you upstairs and we'll talk to you and your wife about your options." So the options were I had one and only one chance to really, an opportunity to prolong life, and this is the bypass surgery that Dr. Moore performed. I found a way to make it right with my Maker. That occurred about that time. And so I asked Dr. Wilbert for 2 favors. I'd never met him before. And I said, "You haven't met me, you don't owe me anything, but I really sincerely, man to man, need to ask your help for 2 things. One is, I need you, because I don't understand this hospital, I don't understand cardiologists, I don't understand what I'm about ready to face. I need you to help me move as fast as I possibly can. As fast as this system will allow, I need your help." He said, "I will do that." And I said, "I need you to find me a starter. I don't know anything about surgeons. And I made him laugh. For those of you that know Dr. Wilbert, he's got a great personality. I made him laugh. I said, "I don't want a bench player, I want a starter." He said, "Just a minute." He walks out of the room, comes back a couple minutes later. He said, "Okay, I will help you. We're going to move very fast, and I found you a starter." Well, there's my starter. So I want to I don't know how you all are in your personal lives, but if I had an option and I were to pick a surgeon, in this case, I got lucky. I didn't pick. But if I were to go hand pick a surgeon, this is what I would pick. I would pick one that's experienced, great reputation, skilled, smart, and calm. That's what I would pick. If I were to pick a world-class surgeon, I would add to that list the following attributes: caring, sincere, supportive, compassionate, gentle, humble, and likes ice cream. That's a world-class surgeon right there. I'll tell you about the ice cream in just a moment. So I said this after I met Dr. Moore. June and I were in his office, and he saw me and talked to me and examined me and does whatever he does prior to him taking on a surgical patient. I assumed he had taken me on at that point. Maybe he was just sizing me up. I'm not really sure. But I did tell him before we were done. I had to tell him this. I had to tell him, I am at peace with my Maker, but I've also done a horrible thing, and I need your help. The horrible thing that I've done is I've crippled my wife and my life. I've worked so hard at being the provider and the fixing everything. I've probably done a disservice to her. And even though if it's my time to go, it's my time to go, I need you to do everything you can because it's not time for me to go from her perspective. I would guess that, and I said, with that, I really need you to bring your A game. I'm sure surgeons hear this all the time, and I'm sure most surgeons would reply, absolutely, I'm going to bring my own game, my A game. It's not what Dr. Moore responded with. He won't remember this, but I will remind him exactly what he said to me. He said, I'm honored, grateful, and privileged for the trust and faith you're giving me by putting your life in my hands. And yes, I will bring my A game. That's why I knew I had a world-class surgeon available to me. Now, I can't say this without it sounding serious, but it's really meant to be funny. He goes on to tell me, I need to tell you something, Kevin. On Monday, I'm going to hurt you. And to put things into perspective, the reason he said that was he was telling me that because I've been asymptomatic, that I'm going to go through the surgery, I'm going to recover, and I'm going to come out of it, and I might not feel any better than I did beforehand. I actually do, but I might not. But just now, can you imagine what I've gone through, and all of a sudden this world-class surgeon is looking at me and he says, I'm going to hurt you. That is just bizarre. So I want to tell him something. Dr. Moore, you didn't hurt me. There's no way you could ever hurt me. And the reason why you didn't hurt me and the reason why you never could hurt me is because there's something that you did. And what you did is you loved my family. And thank you, sir, for doing that. I appreciate that. The night before my surgery was the Sunday. It was an ice storm. I was very anxious about how do I get to the hospital at 5:30 in the morning or whatever crazy time it was. And again, so my wife and I decided to stay at one of the hotels that was literally right across the street from the hospital. My wife, who's never asked me for anything, asked me, I need to ask you something. I said, sure. I mean, I got all the time in the world. She said, I want you to know that oftentimes in this type of a surgery, sometimes patients come out of them, or sometimes patients talk about the light that they saw, that they were attracted to, that they want to go through. And I know this is incredibly selfish, but please don't go. Fight it. And knowing my personality, I made some kind of a joke. It really wasn't that funny. My parents have moved on, and I said, yeah, if I see my mom and dad, I'll say, hey, Mom and Dad, how are you? I can't come over right now. But it frightened me. But I understood where she was coming from. The next thing she said was, oftentimes in this type of surgery, sometimes the patients talk about hovering above and actually seeing the surgery being performed. Don't be afraid. Okay. Anyway, the next day she asked me if I saw the light or saw the surgery, and I didn't see the light, and I didn't see the surgery, or I didn't see it. I won't say I didn't hear something, but I didn't see it. Music, good rock and roll music. So here's what you all knew. You knew that you had this overweight, asymptomatic, heart cath, diabetic, high blood pressure, triple bypass guy. What you didn't know at the time, even though I know you can appreciate it, you didn't know the depths and the fear of the depression and fear and anxiety that I had about the what ifs, why me, et cetera. And you also didn't know that how much my wife's world was at stake and how much there was going to be a watchful eye, because I have the benefit of having an RN on my team that's been highly skilled, highly trained, highly respected by her community. And the beautiful thing is that when she met Brendan, when she met Aditha, met Beth and others, I was getting nothing but you're in great hands, you're safe, they're awesome, and gave her the ability to go home and rest and not worry. So, no, that's okay, hang on. So I want to tell you about these little things, how doubt, anxiety, fear, and depression turns into what I call a new beautiful life, and something I term Life 2.0. And if some of this makes you mad, it's okay. If some of it makes you laugh, it's cool. Don't throw the tomatoes. So first introduction at the hospital, meeting a gentleman that has a smile the size of the state of Texas. Must have won the Guinness World Book. A guy that was more interested in how we're doing, making us feel comfortable, than signing a piece of paper and doing whatever I've got to do on the business side before I go up and have a procedure. And not only doing that, but say, you know what, I want to personally escort you up to where you need to go and introduce you and get you acquainted and make sure everything is okay. Versus There's the elevator, go here and do that. That's how it started. When I was being prepared for a heart catheterization procedure and also for the heart surgery, people that came in to prep me and start the IV, it wasn't about stick the IV and let's get it going, let's go. Wait, it was like, we're going to take our time. We pride ourselves in doing things right for our patient. Are you okay? Are you comfortable? Are you calm? We're not going to do anything until you're ready. Just made me feel so comfortable. This is the one I love. You can laugh. This is the one Mark Valentine doesn't think is too funny, but now I've convinced him it really is hilarious. It's really great. So this is when I was having the heart catheterization procedure. This particular nurse must have known I was just a ball of nerves. The guy comes up, puts his arm in, and says, "Hey, you ready for a sex change operation?" I laughed. He got me to laugh, and I said, "You know, that is the best thing I've ever heard. Let's go." I was ready to go. So the entire nursing staff, I mean, I could just go through countless names. The confidence, the take charge, passionate, nurturing protectors that they are was great. I'm going to embarrass her. She's wearing a nice, pretty yellow top, Editha. I'll look at her putting her head down. Oh, goodness gracious. I call it the night games. This sounds kind of bad, but the night games, she had to come in and check my blood sugars every hour. And like clockwork, for some reason, I would wake up right before she came in. It got to a point where I was faking like I was asleep. She'd come walking in. She goes, "Are you asleep?" And I just throw my hand out. Like, go ahead and take the blood sugar test. So it got to be a game. Then the game was who could guess closest to what the result was going to be. So wasn't it interesting how this caring, loving nurse got my mind onto a game and onto something else versus the pain that I was in? What a great testament to something like that. And I'm going to tell her something she doesn't know. And I tried so hard. Every time she would leave my room, she had to go see her other patients and do what she does. And like clockwork, I knew about the time she was going to come back. And when she'd come back, she'd always poke her head in the window and look to see how I'm doing. Right? And I was always acting like I was asleep, but I wasn't. One time I said, when she looks in that window, I'm not going to be there. When she leaves, I'm going to get up, I'm going to go in the bathroom, I'm going to hide. And so she leaves, and I sit up, and I go, "Oh, I can't do it." And it hurts so bad, I couldn't do it. And so little does she know, when I was asking for the pain medicine, she came back, I was trying to play a joke on her, and that's why I was in such pain. But she never knew that. So. Security guard at the hospital telling my wife, "I feel he's going to be okay and come home soon." He spoke with a gentle smile. It was more than just about me and the patient. Caring for my family, notably kind to her, expressing compassion, everybody always friendly and positive. "Hi there, could you use some help?" This lady goes whizzing by my room and backs up, and she looks at me and she goes, "Could you use some help?" I'm looking at her, I don't know who you are, but come on in. "Yes, I need some help." I was stuck. I couldn't get back into the bed. It happened to be a nursing supervisor there at the time that just decided to help. Who does that these days? I mean, you all, but I know you do because I lived it. I love this one, 2 tubes for the price of 1. I don't know if you know about this particular surgery, but I woke up, I had wires and tubes coming out of me. I didn't know what it was, and it didn't feel that great. He mentioned Terry was in his introduction. Terry Guajardo worked with me. Anyway, the day came, she was coming in to take a couple of tubes out, and she said, "Dr. Moore doesn't want the third one out." I said, "Come on, Dr. Moore, we get that third one out." Anyway, she tells me what's going to happen, how she's going to take them, 1, 2, 3, breathe, and all this kind of stuff, and she's going to take one out, then take the other one out. I went through that. She took the tubes out, and I thought, "Oh, God, I can do one. Just got one more to go." I looked down, and she had 2 tubes in her hand. She had a big smile on her face. And I said, "You got them both. I don't have to do that again." And in Terry Guajardo style, she said, "How about that?" I can just remember her voice, "How about that?" So if any of you know Terry and see Terry, tell her I made fun of her at this thing. I'd appreciate that. Okay, food service people. Somebody brought food in, and literally, whether it says, "Here's your food," and call us if you need anything, they said, "I hope you enjoy this, and please call if you can do anything else." Beth Z in this room. Where are you, Beth? There she is. Now she's getting embarrassed. She didn't know this, but in my business world, there was a time in my career where I was nicknamed a warrior. There was a time I was nicknamed the leader. And most recent last couple of years, I've been nicknamed the leader of the rock band that also can play an instrument. So this term rock band has some connotation in my business life. Well, one day she said, "You're a rock star." I thought, nobody's called me a rock star in here. That is awesome. Do you know how energized I became just when she called me a rock star? I hope she called all of her patients rock stars, but that day she called me a rock star. That was the same day that when I was able to do something, that I accomplished something, I got a high five. A high five. How about that? And a clap. I can still hear you clap as I did something as you walk out of that room, and I will hear it and know it for many, many years to come. You need to know that. Please call me anytime, really, no questions, serious, truly, I'd love to hear from you. As busy as Terry is, that's what she said to me. Because I'm an inquisitive, Dr. Moore knows I'm an inquisitive guy. I like to ask questions. I figured Terry was sick of my questions, but she said, I want you to keep asking. Call me anytime, no matter how trivial. Pleasant day to you. I won't be long, but if you come back, but I can come back if you prefer. Somebody was in there cleaning the room. Told me, pleasant day to me. Who in that world does that? That person did it that day. I was leaving the hospital one day, and there was somebody washing the windows, and I stopped, and I said, man, those windows look great. I hope I don't mess them up. And he's getting off of his knees as he's working away. He turns around and looks at me and says, quite all right if you do those, sir. It's quite all right. Who does that? I went to rehabilitation after my surgery. I still like to think I was in the best class, so I hope you know, I just still think I was in the best class. 6:30 in the morning, it's bright and early. There's a lady that works the night shift just outside of the emergency room that sits behind a glass window, and I never really met her. She had never met me, and I really didn't know what she did, and she probably assumed I was there for cardiac rehab. But interesting how I'd park my car, I'd walk in the hospital, I'd turn the corner, and she'd look up and she'd give me a smile. And then the smile turned to a smile and a wave. And I got that every day. I used to be driving down the toll road at 6 o'clock in the morning and say, I'm looking forward to my smile and my wave. That's the kind of thing, that's the kind of impact that angelic things do. I since went back and made sure I introduced myself to her and told her the kind of impact that she had on me. This is one day, I'm in cardiac rehab, I'm on the treadmill, and I'm doing okay, I guess. And I just had a silly thought, and I thought, what happens if I start running? And I never ran. I didn't know if my heart would give out. I didn't know if it was okay, but the folks that work back there, they're sitting there watching the monitors, and they're walking around working with the people doing their rehab, and I just want to see what happened if things change. So I start running, and I see the one of them that's behind the counter. She's having a cup of coffee, just kind of being relaxed. All of a sudden, she's looking at the monitor like, oh my God, something changed. She looks at the monitor, and then she looks right up at me, and I'm running. I'm looking like, oh, I better not be doing this, right? Is it okay? And then she smiles at me like, it's okay to fly, keep going. Never appears to be a job, high amount of gift of skills in this room, confidence and approach to new life. There was a nurse that came by to check my temperature or do something that wasn't really assigned to me, and he was helping out with somebody, but he wasn't even assigned to me. And great guy, I don't even know his name. I know him if I saw him. I don't even remember his name. But he provided me encouragement. He showed me extra ways how to do the respiration thing, to do it right, to make sure I get the walks in, make sure I'm sitting up in order to be healed and discharged. He didn't have to do that. He could have just come in and taken my temperature, done what he's doing, and leave. Very, very kind. So the little things actually appear in baseball. So I was blessed and honored to have an opportunity to go to a Rough Riders game, and they called it Home Run for Life. And Dr. Moore and his wife were there, and it's a great occasion. But you know, there was an inning during that game. I got to run around the bases, and these young professional baseball players, their game was stopped because of this brief ceremony thing that I was involved in. And I'll tell you what, nobody would ever know how important this was. As I was running those bases and clapping those young 19, 20, 21-year-old guys, and I'm some old guy that had some heart thing, and they're like, hey, we just want to play the game. Do you know what every one of them was saying? It's like, way to go, good job, keep it up, you're looking good. And nobody in the crowd could hear that. I heard it. So angels come in little things. So I'm going to tell you about the ice cream. I know you've been waiting. So somewhere on that picture, bottom right, is the dessert tray they had at this event. And they had cakes and stuff, and everybody there was grabbing it and eating it. And I'm just kind of like, I don't know if I'm supposed to do this, because I used to do too much of that, and that's why I'm in the situation that I'm in. And I saw Dr. Moore. Well, I don't want to get you in trouble, but I saw him going over to the dessert tray. He got something. About that time, they brought a cup of ice cream, a baseball cup with ice cream in it, and boy, that looked so good. And I looked at him, I said, you think I could do that? And he goes, yeah, I think it'd be okay. I think it'd be okay. So I got a thing of ice cream, and in that moment, he doesn't remember this, but we didn't really toast or cheer. We just kind of gave, how guys do, they kind of go cheers, like, hey. So that's what we did. And that moment of cheering ice cream with my surgeon was cool. That was really cool. So let me tell you what all this means. So the little things that you find in tenderness, compassion, protection, safety, all the way through humbleness. The little things that you find in there. What's the impact, the relevance to a patient? In my case, it gave me a sense that me and my family were relevant and of value and important. And it gave me a sense that I'm okay and I can do this. So what might you want a patient to aspire to? I've lived this, so I can talk about it with me. Your knowledge and your skill and your teamwork actually gave me confidence. Your encouragement is what delivered the hope that I had. And your attitude and approach actually gave me a life to live. So it helped transform me into a why bother to a sense of purpose. So it really set me on a track to motivate to show you something. So I often tell people the reason I'm on the treadmill every day and the reason I'm eating chicken and fish and the reason I'm taking the meds the way I'm supposed to be taking is because, yeah, I know it's good for me. But I feel motivated. I feel motivated to show you all what the potential outcome could be. Because I know some of the dirty little secrets and truths about the profession that you're in. They're not always great outcomes. So you deserve to know what it could potentially mean. And I want you to know how highly motivated I am by that. And I want you to know that everyone contributes. Yes, I was lucky. I had a great surgeon. And it goes well, as Dr. Moore talked about, it goes well beyond that. It goes beyond nurses. It goes beyond food prep people. It's everywhere. Did you know the degrees of separation in your industry are so very, very small and so very important? You could do something to impact one of your colleagues' days or lives and then impact the life and the day of one of your patients. And you probably don't know to what degree that you can. So I want you to tell you something. I saw how you give and you give and you give and you give until, and then you go home and you're completely drained, you're completely spent, you're exhausted, and guess what? You do it again the next day. And I also recognize that you're just like me. You have bills to pay, you've got life's interruptions, you've got everything. But you know, the difference is you put your life on hold for me. You taught me about my medications, what they do, why I need them. You taught me how to eat. You taught me how to exercise, how to smile just because. You taught me how to be kind to a complete stranger and how wonderful that is. You taught me the importance of humor in recovery. You taught me, you encouraged me, you challenged me, you even high-fived me. You gave me all of this, and not one time did any of you ask me for anything in return. Not one time. So I'm motivated to show you what the potential outcome could be, and I give it a term, I give it a name. I call it Life 2.0. And I want you to know that, yes, I've done a good job, I am progressing, I will continue to progress, but it's very important that you know I will never forget. I'm not just some guy that was at the hospital and was a great story and is out. I want you to know that I'm out there running around Dallas-Fort Worth, and I'm always thinking and I'm always remembering. So this is what it is. Perhaps as the angels would, affecting the physical, the mental, and the emotional. I have a 7-day-a-week cardio habit. That's a little outdated. Last week I estimated that I've gone 524 miles on a treadmill. It's not a lot, but it's a lot for me since this happened. It's probably in the close to 540 miles. I've lost close to 50 pounds. It was 50 pounds at one time, and it was a little weakening. I gained some of it back, but I lost a large amount of weight. My vitals, at least the last time they were checked, were excellent. And the doctor that told me at one point in time, just over a year ago, you need to go to insulin, now has given me the license to tell people I have beat diabetes. I'm on no more medication whatsoever for that. When I was in rehab and I learned how to do this and what I was taught, I learned to make some choices. I kid you not, when I would get up in the morning during the day, I'd say, make the choice, live or die, make it. And I'd force myself to make that choice. Getting on that treadmill and doing that exercise became easier when I'd make the choice to live. Because I knew if I made the choice to die, I just wouldn't have to do it. I then graduated from the live-die choice to making a game out of it. The game was, I learned in cardiac rehab, they showed me, I was wondering, why does my blood sugar have to be 100 before I can get on this machine? Well, I didn't know that when you exercise, your blood sugars really drop. So they taught me that. So I learned that the biggest trick to jack up the blood sugar was eat a banana in the car. And by the time I got there, it was like 140, 150. It was cruising, so I could get on the machines. So then it taught me, I said, you know what? It's interesting. I'm going to start to learn how my body works. I'm going to eat a meal. I'm going to let my blood sugars go way up. I'm going to jump on the treadmill. I'm going to see how far down I can drive them. I'm going to see, what does 20 minutes do? What does 30 minutes do? What does 45 minutes do? I want to know. I want to learn how I work. So I made a game of it. And besides I had a game, I had something to look forward to do. You taught me this. I didn't know how to do this. You taught me. Moving on, never forgetting. Emotional. I do everything I can. There was a point in time I was afraid of dying. Afraid. I was high anxiety. You know, I had a chance to tell Dr. Moore beforehand, this is one of the most beautiful things that I'm experiencing right now is the fact that, yes, I am working hard on the exercising. I'm trying to work hard on the eating, and I'm absolutely working hard on making sure I'm taking my medications on the schedule I'm supposed to be taking. So I'm doing everything the world has to offer. So what is there to worry about? There's nothing to worry about. Just do. And I try my best to honor others because I have been so honored throughout this process. So Life 2.0 is working at getting the maximum I can out of life as a testament to your profession that every one of you matters, everyone's relevant, and the impact on lives is probably far greater than you can imagine. So I've given my story. Somebody made a comment about billboards. The marketing department here has blessed me, and it's not that they blessed me. I'm hoping they're blessing other lives. So Dr. Moore made a comment about seeing you could have picked a better picture to put on the billboard, by the way. I'm just kidding. So I've gone in public and I've talked. I've been on billboards. I'm on the internet. I've been on television during American Heart Week. And that's all been fun. And it's because I'm motivated to share what can possibly occur when all the pistons are firing, when everything's working together. I could have been a guy that had heart surgery. I lived and I went on about my business. It was so much greater for me, so much greater of an impact. And I really need you all to get it, that I'm motivated by showing you what can be. So they carried me, they cared for me, they taught me. It's the way it fell into place, the fateful question, the rapid connection with the right surgeon, the little things that occurred with me, the way I evolved stronger mentally, physically, emotionally, and spiritually, the outcome. I have a sense that I'm here for a reason. I don't mean here on this podium, but here in this life at this point in time. I felt them, I sensed them, I saw them, and as I said before, I absolutely know for a fact they come in many forms, these angels. So, who are they? The angels, who are they? They're the angels. That's the angels in you. It's not somebody with a harp and a violin and somebody, it's the angels that I actually see in people that I've never seen before. I've never had the ability to witness before until I came in contact with the likes of you all. It's the best blessing I've ever had. So I want to thank you for Life 2.0, and I have a little thing to give back to you in wrapping this up. I'm glad to see from the prompter back there I'm doing just good on time, so that's good. I wrote you all a letter, and I literally did write it from the bottom of my heart, and they have told me it is in your packet. And if you don't mind, I know you can read, probably better than I can, but since I wrote it, I would love to read it to you. And I have to put away my vanity and put on my old man reading glasses to do that. So this is to the Cardiac Innovations Conference attendees. You have life's battles, interruptions, frustrations, and challenges just like everyone else. But yet every day you give and you give and you give until it never seems to be about you. From the deepest and innermost self, I am profoundly grateful to you and remain overwhelmed by the appreciation, indebtedness, and praise I have for each of you because of your beautiful giving ways and your relentless pursuit of quality care. You do motivate me, you inspire me, you humble me. A day does not pass where you're not in my thoughts and prayer. My wife and I are blessed and honored to have experienced the best of your talents, your compassion, your passion, and above all, your grace. Thank you to the angels that walk among us. Life 2.0 is a miraculous journey, one I praise you and your noble profession for putting me on. Although it's just a little thing, I am infinitely thankful to you for your dedication and endless pursuit to provide gold standard care to your guests and your families and their families. I would love for this letter to find its way into your hands so that one day when you need it most, you can feel my encouragement, my acknowledgement, and appreciation of you, so that the angels can carry and care for you as they did me. And in doing so, touch you with the little things. May God eternally bless you, Kevin Jr., and Jennifer Kirksey. I wrote that specifically for you. And those of you that have seen me or heard from me on email, and when I send you an update, I never come across and say it just right. It's never about me. The reason I do that is because it's all about you, and I want you to see. So, in closing, that was the letter I just wrote. In closing, I want to thank you for the angels indeed walk among us. They do indeed. And I want to thank you for letting you walk with mine. Thank you. Have a great afternoon.